she was more nervous about having this removed than she was about childbirth.
And women at home are like, what?
Exactly.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
Happy Monday and welcome back to the Ask an Audiologist podcast. I'm Kevin Ziener.
And I'm Dr. Jordan Strong.
Today, Dr. Jordan will be tackling an article from Dr. Joan McCormick, formerly of Atlantic Hearing Care, and the aforementioned topic will be earwax and its effect on hearing tests. Dr. Jordan, I know this is only your second episode, but I have, as well as probably millions of other people, a soft spot for earwax removal, all things earwax. So please give us your best, worst, grossest earwax removal story.
Honestly, I feel like it's all of the above.
Yes.
It is.
Lay it on us
Let me
thick.
also lay it out that this is my favorite thing to do as an audiologist.
Okay.
Like if I could just do this all day, that'd be great. Love it.
If I could not host this podcast and just stand over your shoulder while you removed earwax, I think we'd have a million followers already.
Yes. Agreed.
So do it. Tell us the grossest, best earwax removal.
So there was, she was pretty young. She came in, she felt like her ear was full. She wasn't hearing very well and wanted it looked at. Checked in her ear. She was completely occluded, which means that you can't see anything to that ear canal. That ear canal is completely full of dry wax.
Okay.
So to get that out, for her, we used irrigation, which is where we put some water in her ear to flush it out.
Like that. It's kind of like the super soaker that's got the guard for you so you don't get splashed.
That's
you kind of
right. It's
move
called the
it
irrigator.
in a circular motion, right?
Yeah. Clever name, irrigator, right?
Yeah.
So we use that, and it's great because it makes sure that the water temperature is where it should be. So it's not too cold, not too warm. However, this girl came in with a terrible story where she had attempted to have it removed elsewhere, and they put, I don't remember if it was cold or warm water, but it made her very dizzy, which it can if you use too cold or too warm of water.
Okay.
So she was terrified for me to take this out of her ear. But with the type of wax she had, that was the only way to get this out.
Meaning you weren't going to be able to use like a little curette to pull it out
Correct.
slowly. Okay.
Yeah.
Or what are the other things called? Alligator?
Alligator forceps.
Yes.
There's suction. There's lots of different ways.
Thank you.
Actually, I am very impressed.
Thank you very much.
So I start flushing it out, and I have my assistant that's there, and she is holding her hands for her because this girl is stressed.
Yeah.
She said that she had actually just had a child and that she was more nervous about having this removed than she was about childbirth.
And women at home are like, what?
Exactly. Yeah. So I thought she was going to pass out. There was a lot of screaming. There was a lot of gripping. There was just a lot of stress that was going on. So
when you ultimately got it out, did it come out in pieces? Did it come out in one big clump? How did it come out?
It was one big piece, which is definitely the most satisfying.
For sure.
Oh, yeah.
And are we thinking now granted, people at home are going to be like, I don't know, like a quarter of an inch? Like if it was an inch, that'd be terrifying.
Oh, yeah. Definitely not that.
But
much.
So in my mind, I'm thinking I don't know, 3 centimeters?
Thereabouts, maybe a little bit bigger.
Oh my gosh.
Yeah,
so
it was huge.
4 centimeters and then like a width of a centimeter or two?
Yeah.
That's amazing.
I mean, it was massive.
So I think it goes without saying that if you have 3 centimeters worth of impacted ear, that may affect a hearing exam, right?
Yes.
So talk to us a little bit about that initial fullness that somebody might feel, or the fact that somebody isn't hearing and the steps that we should all go through before we just assume we're deaf.
Sure.
So hit us with like the initial, we should not go to Dr. Google initially. Hit us with the things that we should do if we start to feel like our hearing is going. Yeah.
So as wax starts to accumulate, you may start to feel like kind of an itchy ear. A lot of people start to feel that itch. And then unfortunately, lots of people start to stick things in their ears to scratch their ear. Please don't do that. Not a great idea. only going to cause further issues. And then from there, if you feel like you've kind of washed your ears out in the shower, you can kind of hold your ear up to the water, that type of thing. You still feel like it's kind of full, maybe itchy, you're not hearing quite as well as what you normally are, then definitely that's going to prompt, let me go see either my audiologist or an ear, nose, and throat specialist.
Sure. And so when you finally take that action and they come and they see you, what is the first thing that you as a doctor do? Do you get out that otoscope?
Absolutely.
Okay.
Absolutely. Typically, and of course, we're going to ask a case history first. And again, that's going to kind of gear us of where we're going to go.
Sure.
And then from there, we'll take a look in the ear using an otoscope, which is just using light magnification so we can really get in there and see what's going on. And see the type of wax, how much wax, is it dry? Is it soft? All of those things are going to help us determine how we're going to remove the wax.
In your professional opinion, typically when you see a certain amount of wax, do you know, like, this person may have hearing loss, but it's pretty much the wax that's causing the issue?
Yeah. For some people, they'll come in and say things like, well, it's gotten worse recently, but I think I had a hearing loss before. And it's like, okay, well then it's probably just added on top of the hearing loss that there's some wax that's also blocking.
Sure.
So we'll have the wax removed and then we'll test the hearing.
Got it. How many times when you see a patient, is it traditionally just earwax that's the culprit?
It's pretty rare.
Oh, really?
It's
okay.
actually pretty rare. Yeah.
That's good.
Yeah.
I mean, maybe not good. Maybe I should rephrase that. It's good that the ear is not impacted so that the diagnosis might be a little easier.
Right. And now I will say everyone comes in hopeful that that's all it is.
True.
You know, they're always coming in. They're like, what do you mean there's not wax? There has to be wax.
Yeah.
There has to be what's causing this.
How much wax, like, would you actually need to see before, like, you needed to remove it to perform an actual hearing exam? Like,
Yeah.
Is it just even a little bit, or can you not, like, see the actual drum?
Yeah, so it's when we can't see the eardrum
Okay.
that we're like, okay, this needs to come out.
Sure.
Because at that point, we can't get like an accurate pressure test where we put some, it's a little bit of pressure that goes in the ear, a little bit of humming. And we measure what that eardrum is doing. But if that wax is blocking from that pressure going in and hitting the eardrum, then it's got to be removed.
Yeah. And so then my other question, and I've actually never asked this on this podcast before, what type of wax producing do hearing aids have, or does it really affect it at all?
Yeah, so that's a great question. So
Thank you.
Yeah,
Full
really,
of them.
that was great.
At least one today.
So it is pretty common that, especially when people first start to wear hearing aids, that their ear can actually produce a little bit more wax than usual. Our ears they're natural to produce wax, but what happens is our ears recognize, hey, something foreign's in my ear.
Sure.
Let me produce wax to try to push that out.
Oh, okay.
So it is pretty normal that at least in those first few weeks of wearing hearing aids, that you may produce more wax, but after that, it'll the wax production will slow down.
Got it. So here's my question for you. Obviously, this podcast exists on YouTube, as do a bunch of other earwax removal videos. This is your job. You do this every day. Do you have any proclivity or any interest in watching earwax removal in your free time?
It's my favorite thing.
Really?
Absolutely.
I remember the first time, and I think I've talked about this on the podcast before, like those pimple popping videos.
Love them.
So good. So disgusting. So gross. I hate myself, but now it's 2023. We can talk about these things in public. Then it's like a slippery slope, because then you get to earwax removal, right? And then you can go down a horrible rabbit hole of other things.
Absolutely. Yes.
But I find, especially when you're able to get those alligator forceps and just the whole
Pull
thing
it out in one big piece. Those are so good.
Why is that so gratifying to us?
Right?
It's amazing.
It is amazing.
There has to be something biological in us where we're like, this is
Agreed.
the thing I love.
Yes.
Man, oh man, do I love talking about earwax.
I do.
And if you want to learn more about earwax or earwax removal or hearing exams or anything else audiology related, head on over to askanaudiologist.com. Dr. Jordan, thank you so much. I also want to go on record by saying, yes, technically it is my birthday today.
Woohoo! Happy birthday, Kat.
Thank you. And credit to me for not bringing it up until the very end of the show. That's professional. That is a seasoned vet who does not make it about himself. And I want to I'm not going to chastise Dr. Jordan for not saying happy birthday to me, but that's credit to me. Credit to me.
We just wanted to end on a bang.
Yeah, thank you. So again, went the entire episode without mentioning that today, July 17th, is my birthday. But again, you guys, thank you so much. Thank you. I'm a professional. It's not about me. It's about audiology.
But still, happy birthday.
But still, thank you very much. Dr. Jordan, thank you.
Absolutely.
We'll see you guys next week.
See you.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only, and does not substitute for professional medical advice.
These patients will experience things like just deep-seated anger when they hear pen clicking. A lot of times it's oral sounds, mouth noises,
Sure, like
chewing,
chewing,
clicking, that sort of thing, like my 4-year-old does.